Hi, my name is Robernis Porto Real. My number is 106-15300. The teacher is Sabino Morla, section 32, subject English Technical Salute 2. And I'm going to speak about of the nuclear medicine. What is nuclear medicine? Nuclear medicine is a medical specialty that uses radioactive tracers, radiopharmaceuticals to assess bodily functions and to diagnose and treat disease. Especially designed cameras allow doctors to track the path of these radioactive tracers. Single photon emissions computer tomography or SPECT and positron emissions tomography or PET scans are the two most common imaging modalities in nuclear medicine. What are radioactive tracers? Radioactive tracers are made of carrier molecules that are bonded tightly to a radioactive atom. These carrier molecules vary greatly depending on the purpose of the scan. Some tracers employ molecules that interact with a specific protein or sugar in the body and can even employ the patient's own cells. What is single photon emission computed tomography, SPCT? SPCT imaging instrument provides three-dimensional tomography images of the distributions of radioactive tracer molecules that have been introduced into the patient's body. The 3D images are generated from a large number of projections images of the body recorded at different angles. SPECT imagers have gamma camera detector that can detect the gamma ray emissions from the tracers that have been injected into the patients. What is positron emission tomography? PET. PET scans also use radiopharmaceuticals to create three-dimensional images. The main difference between SPECT and PET scans is the type of radiotracer used. While SPECT scans measure gamma rays, the decay of the radiotracer used with PET scans produce small particles called positrons. A positron is a particle with roughly the same mass as an electron, but oppositely charged. What are the nuclear medicine scans used for? SPCT scans are primarily used to diagnose and track the progressions of the heart disease, such as blocked coronary arteries. There are also radiotracers to detect disorders in bone, gallbladder disease, and intestinal bleeding. SPCT agents have recently become available for aiding in the diagnosis of Parkinson's disease in the brain and distinguishing this malady from other anatomically related movement disorders and dementias. The major purpose of PET scans is to detect cancer and monitor its progressions, respond to treatment, and to detect metastases. This is an example of the detected tumor. And are there risks? The total radiations discomfort to patients by the majority of radiopharmaceuticals used in the diagnostic nuclear medicine studies is no more than what is conferred during routine chest X-ray or CT scans. There are legitimate concerns about possible cancer inductions even by low levels of radiation support from pulmonary medical imaging examination. But the risk is accepted to be quite small in contrast to the expected benefits delivered from a medically needed diagnosis imaging study. Sense.